Okay, I will just continue my previous lecture. So I'm talking about the ascites. Actually, what's how ascites develop? Actually, when there is a liver disease, so liver disease, there is a portal hypertension. When there is a portal hypertension in the portal vein, there is an increased blood happen, increased pulling of blood in the vein. In the arterioles, there is less blood, so that arteriole go into the kidney, so kidney is taking less perfusion. When kidney is taking less blood, so it activates renin mechanism, ROS mechanism. So ROS mechanism do what? They have water and sodium retention, so again ascites become worse and worse. That's why we give in that ascitic patient spironolactone potassium sparing diuretics, and we will diuretics like furosemide. So this is the main pathophysiology how ascites develop. So ascites develop due to what? Increased portal hypertension or increase or progressive liver disease that lead to what? Portal hypertension. So portal hypertension increase the pressure in portal vein, and increase the pressure in portal vein decrease the blood in the arterial sides. In the arterial side less blood, so renin mechanism become activated. And then there is a bruise. This is a bruise, this is a chronic liver disease feature. Why? Because when there is a chronic liver disease, there is a loss of vitamin K, there is a loss of anticoagulation factors. When there is a less vitamin K, so more and blood, because if any small trauma inside the vessels, then there is a pulling of blood from the vessel into the interstitium, and they give like a bruise. Any small trauma even give bruise, because in normal physiology, if someone develops small trauma, so anticoagulant do what? They coagulate the blood and they avoid the bleeding. But in a chronic liver disease, what happens? There is no clotting factor properly, vitamin K deficiency, they lead to what? They lead to bruise. And the liver disease patient, they also give a symptom of anemia. Why? Because iron, vitamin B12, they also absorb in the liver. When liver is not working properly, so they will give a clue about symptoms of anemia as well. Then there is a Polymer Erythema. So Polymer Erythema is due to what? Due to increased estrogen level, and that estrogen level do what? They increase the vasodilation. So vasodilation lead to what? Polymer Erythema. And Polymer Erythema also due to hyperthyroidism as well due to anxiety, but most commonly also liver disease. Okay. And then there is a clubbing. This is a clubbing which is very common in chronic liver disease patient. This is a normal, see this is the angle because of squamous sign. With when this hole is present, it mean normal, but when this hole is absent, it means there is a club. So clubbing can be due to tuberculosis, bronchiectasis, liver disease, but most common in the liver disease. This is also a sign for GPE examination in chronic liver disease. Also there is a normal spleen, and then there is a splenomegaly. So when liver is not working fine, chronic liver disease, so portal hypertension develop. So portal hypertension lead to what? They again reverse the blood from the portal vein into the liver, into the spleen. So spleen develop what? Splenomegaly, means spleen need to work more and more. So spleen become hyperfunctioning, and then there is a thrombocytopenia, platelets destruction. Why? Because bone marrow is working fine, but the small capillaries in the spleen, they destroy the platelets. So the patient develop a thrombocytopenia, platelet deficiency. So they also develop bruise sign. So this is the thing. So I hope so you understand today this hepatology lecture very well. So actually I divided this lecture into 7 lectures. Why? Because I just divided by myself, that it's easy for you to understand everything very clearly. So I hope so you understand this well. So this is a just like a medicine lecture, first medicine lecture about the hepatology. So in my next lecture I will upload about as well hepatology lecture and GIT lecture as well about in the medicine. So I hope so you will understand. So if you have any question, so you can ask me. Okay, thank you so much.